Traditional Chinese acupuncture, when practiced correctly according to natural laws, is one of the most beautiful systems of medicine known to man. It is both an art and a science. The fundamental principle of its practice is the giving of constant attention to diagnosis and treatment of causes rather than the symptoms of disease. Qi energy is the life force which creates and maintains all living forms. Yin and Yang are the two aspects of that energy. Both are always present and together. They represent the dual nature of all events and situations. They function in relation to each other so that one cannot be separated or isolated from the other. Everything that lives demonstrates the presence of Yin and Yang, and never is anything comprised solely of one or the other. They complement each other as night and day, as winter and summer, as female and male, as moon and sun. Balance is, however, crucial to a good state of health. If yin and yang are in harmony, there can be no disease. But if serious imbalance occurs, then the body, mind, and spirit systems become disturbed and disrupted, and disease ensues. When the energies of yin and yang are in balance, the organism is in a state of free and stable flow, a situation which promotes the health and integrity of the body and mind. When the balance is upset and the pathways of energy are constricted or blocked, then disease assails and weakens the areas of the organism. Ultimately, the energy system breaks down and death supervenes. It is worth noting that in all aspects of Chinese medicine, the practitioner contemplates the individuality of the patient. It is not possible within this system to treat all people the same. It must be borne in the mind that each person is a unique individual, the like of which God the Creator has never made before and will never make again. We are each of us different as chalk from cheese, and therefore this system demands the practitioner investigates the cause of disease as being unique to the individual in his or her care. Thus one can appreciate the importance of the personal relationship and rapport that needs to be established between the practitioner and the patient. Shelley is a 34-year-old female who came to see Dr. Lin for a variety of reasons, ranging from the common cold to asthma and allergies. Shelley, tell us about how acupuncture helps your family stay well.
My family has, I have a son, Nathan, who has asthma, and 2 other children. And myself and my 3 children have been to see Dr. Lin and Paul Murray for the last 6 months. And we are just thrilled with the results we're getting. Nathan is off all of his asthma medications, and as far as my sinuses are concerned, I haven't struggled with them since we started coming.
When you first met Dr. Lin, you had chronic sinus infections. How are they now?
It's wonderful. I have struggled with them for years and years, probably the last 12 years, and I have been on Flonase and antibiotics, and nothing seemed to help, and I finally found something that gives me relief through acupuncture.
As a mom with young children, things can often be stressful. Does acupuncture help you to manage the stress?
Absolutely.
And how are you and your family's health compared to years in the past?
We are doing much, much better. I am physically feeling better, more energetic, and not dealing with the constant irritation of sinuses and also colds and viruses. The last 6 months we've been feeling great and able to come in and be treated for those types of things.
Dr. Lin often gives her patients dietary guidelines. Are these helpful for you?
Yes. One of the things that she recommended was no dairy. So we've taken all of the children and myself off of dairy, and it's made a tremendous difference in that way. And also sugar. We're staying away from sugar and a lot of fatty foods, trying to eat more healthy.
And would you recommend Dr. Lin to other mothers for family care?
I have, and I will continue to do so, absolutely.
Hi, good morning. How are you?
Good. How are you, Dr. Lin?
I'm doing good. So, how's the vacation?
It was good.
You
We
go
had
to
a wonderful time.
mountains?
Yes, we went to the mountains. And
Okay, how's your sinus? How's the allergies?
doing well. Doing
Good.
well.
Okay, just lay on your back and take out the tongue and your pulse. Can you see your tongue, please? Okay. Okay, and then we'll do the treatment. Last needle is still for your sinus. Okay, just relax. I'll be here about 20 to 30 minutes. Last way is take a nap.
Okay.
Okay, Sarah is a 23-year-old female. Initially, she saw Dr. Lin for poor digestion, poor circulation, and grinding of her teeth. Later on, unfortunately, she was seeing Dr. Lin for pain management as well as controlling the emotion of fear. Hello, Sarah.
Hi.
So tell us about your digestion and how things are going now.
Things are a lot better. I remember when I first came into you, I couldn't really eat much. I didn't have an appetite. I was very finicky. And now I'm eating all the time. But that's good. I haven't had problems in a very long time or stomach aches.
Great.
It's very good.
And how about the teeth grinding?
The teeth grinding, I really can't tell because I'm sleeping and I never knew I did it in the first place, so it's going to be a $1 million question to tell if I'm stuck. You know what I mean? I have to go to the dentist, I think, and have them check, but I haven't felt any pain or anything in my jaw, so
That's a good sign.
yeah, we're working on it.
And tell us about the car accident. What happened?
Oh, I was struck on my driver's side and I didn't even see it coming, and so I really didn't even know what happened. I woke up in an ambulance and was like, oh gee, I got hit, you know, but I wasn't sure what happened, and so there was no real major damage, like I wasn't in concussion, no broken bones. I was just really weak from that hit, and then afterwards I was really afraid to be in a car. You know, even on the drive home, I just didn't want to be in an automobile. I was afraid I was a moving target. There's so much stuff that happened, but that's basically the short story.
Did the acupuncture help you to eliminate those fears?
Oh yeah, oh yeah. Even after that first treatment, I got in my car and I just felt normal. It's strange. I just felt like all that subconscious fear had lifted. You know, I was still very aware. Like I always look to the left side now anytime I cross an intersection. I didn't forget my lesson I learned. You know, like I learned from experience, but I'm not afraid. which is good. I feel natural again.
And you see Dr. Lin for common cold and just regular
Yeah.
female health.
Yeah.
How do you like seeing an acupuncturist for your primary care?
I definitely like it because any ailment I have, she can treat. I haven't needed to see a Western doctor in over a year, I think now. Anytime I have a cold or, with back pain, even emotional issues, you guys work with everything. So she's been my #1 consultant for a while.
Thank you.
Thank you.
And would you refer Dr. Lin to your friends?
I have and I do.
Hi, how are you, sir?
I'm good, thanks.
Good, it looks good. It looks better than before.
Yeah.
And how about you lay on your back and look at your tongue and do your pulse?
Okay.
Will you open up?
Good. Look
The
okay.
teeth mark is gone. We started without the
it?
teeth mark there.
Really?
Yeah.
That's good.
How's your sleep recently?
Well, last night wasn't good.
I know, I can feel you sleep good last night.
Not good or good?
It's not too good.
I didn't
because
get
for the
much. I
pulse,
slept
you
heavy, but it was only maybe 5
look at
6 hours.
some heat in your heart.
Oh, really? She always knows.
Okay, we get ready for needles.
Okay.
Yes, that's good. Thank you. Yes, we need a bolster. Carry hand. So your digestive looks pretty good.
I've been really good. Really good. Better than ever.
Okay, one needle. The digestive. That's good.
Okay. I can't remember last time I had a stomach ache.
Oh, that's good.
Yeah, it's been very good.
Why you didn't sleep good? Go to sleep too late?
Yes, we were out late last night and
You
should have came home sooner than I did, but yeah. But Thursday I got lots of sleep, so
Oversleep?
I did.
I need one more needle. Very close to your tattoo. Is everything okay? Is any needle bother you right now?
Oh, it feels good.
So we'll get some music.
Okay.
And it's nap time. Take a nap. See you about 20 to 30 minutes.
Okay. Thank you.
Nap is over. Do you have a good rest?
Yeah.
I'll take a needle for you. Okay, you're all set. Drink a lot of water.
Okay.
Take care. See you next time.
All right. I'll see you.
Children respond very well to acupuncture as they have not been out of balance long. Let me introduce to you Nathan. Nathan is a 4-year-old boy who, when we first met him, was on prednisone, Flovent, albuterol, and nebulizers. That was just 6 months ago. Nathan, how are you today?
Good.
And how old are you?
4.
And how old were you when you first saw Dr. Lin?
Wow. 3.
And how do you like acupuncture?
Not very good.
Not too good? Does it help you feel better though?
Yeah.
How's your asthma?
Good.
And are you able to go around dogs?
Well, yeah, because once I had the furriest dog, guess what happened?
What?
I didn't sneeze, so I can be around which dog?
You can be around dogs now?
Yeah,
Good. And how's your asthma? Do you feel good?
yeah, my asthma's gone.
Good. And Nathan, would you recommend acupuncture for other children? Do you think it would help other children like it helped you? Good. Okay, thanks Nathan.
Oh, we'll make them straight.
I want it in my hand.
Just one in your hand? Okay. Did that hurt you?
No.
How about this one? Oh, they go to the pet bear. I need one more needles.
That's too fast, huh?
Yes.
Just that one's too fast.
Two on your leg, okay? Just here.
It tickles at first. It tickles at first.
I think you can go.
Dr. Lin received her training in Western medicine, acupuncture, and herbal therapy at Beijing University of Traditional Chinese Medicine. Upon the completion of her 6-year program, Dr. Lin worked as a resident physician at Beijing Xuanwu Hospital. While at Beijing Xuanwu Hospital, she used her integrated medical background to cure difficult diseases such as cancer and cerebral palsy, stroke, MS, and spinal injuries. Dr. Lin specializes in women's health, dysmenorrhea, endometriosis, infertility, PMS, menopause, urinary incontinence, breast and ovarian cysts, fibroids, and emotional issues. Dr. Lin has been trained in the Bioset Advanced Allergy Elimination Techniques. These techniques can eliminate food, chemical, and environmental allergies. Dr. Lin's office is at 8200 East Bellevue, Suite 280E, Greenwood Village, Colorado.